I have the privilege of co-facilitating this last session today with Marie Gray, who is the Youth Cannabis and Commercial Tobacco Prevention Program co-manager with Washington DOH. And her work focuses on community-driven substance use prevention and education focused around youth and emerging adults. So you will see more of Marie at the end for the Q&A. But before that, I want to introduce our speaker. Our final speaker also happens to be the director of SERP and one of our main conference organizers today, my longtime colleague and mentor. Dr. Beatriz Carlini has the privilege and challenge of taking what we've been learning throughout the day today and sharing some ideas for some state-level policies to reduce risks associated with cannabis legalization, availability, changes in product type that increase risk of cannabis-related psychosis and schizophrenia. Dr. Carlini is a research associate professor at the University of Washington, ADAI. Her research career has been dedicated to understanding the public health impact of legal psychoactive substances, so things like alcohol, inhalants, tobacco, and cannabis, and policies on social health outcomes. So help me welcome Dr. Carlini.
Thanks, Sharon, and thanks, Marie, for facilitating the Q&A later. It's a pleasure to be here. It's even more a pleasure to see there's people still left in the audience after such a long day. So this is very good. Okay. So we are going to move from promising clinical practice to promising policies to reduce the onset and progression of psychotic disorders. And the way I'm going to approach this is through these three different subtopics, starting to why policies. Really, why policies? Why not just implement clinical interventions with so much promise we saw today, and also support parents and teachers on educating kids and communicate to their young the risks of using cannabis intensely, maybe abstaining, certainly when they're young, and if we're chosen to use moderately. Why just not to do that? We would say, well, for the task at hand, this is not enough. It's certainly important, is actually crucial, but it's not enough, and that's why policies. So if you look at our task at hand, summing up the learnings of this symposium, we can say that cannabis use is definitely a modifiable, for sure, risk factor to the onset and progression of psychotic disorders, and that we can at least define 3 action points: delay cannabis use initiation and discourage the use of high-potency products and of frequent use. Public health or policies can do a lot to complement clinical education interventions. Actually, if you look at our collective life, promoting healthy interventions is very important. The communities where people live, learn, work, and play define our health and determine our health at a great extent. If you look at, there are several theoretical models that public health use, and that's my background and the background of ADAI SERP. When we talk about doing clinical individual interventions or educational interventions, we are in this model working basically to change or manipulate individual and social factors. We are getting to see the people's motivation to change, their beliefs, their perception of norms, their peers, their families. We are working in this domain, in the individual and social level. When we work on in public health, we complement interventions to change health behaviors that go to the community and societal factors as well. Norms and perceptions of society, access, physical access that people have to choices. So if you think of this model here, let's think you are educating people on healthy foods or in exercise. You can educate them, give information, motivate them to change, but if there is no sidewalks to walk and exercise, no playgrounds, no safety in their communities to go out and exercise or to purchase healthy foods or changing the environment and the norms, you are not gonna get too far. Okay, so in sum, healthy choices are made by individuals, but they can be either facilitated or hindered by social, physical, and economic factors. And policies can change these factors, and that's why we think policy is important. And just an example, I mean, look at all the things that in Washington State you already have in terms of policies and regulations. The age of purchase being 20 years old, man, this means that we are sending a message that it's not healthy to use before that. We are also having a barrier through IDing everybody that goes, and the compliance is very high, that are going to a retail store to not be allowed to purchase these products. We are wrapping edibles in 10 milligrams sizes or portions. Yeah, there might be some environmental waste related to that, but just look at the public health gains on clearly sending a message that this amount is enough. You want to indulge, you can put yourself at risk, but you are showing wrapper by wrapping that this is the amount that is reasonable to take. Same thing about retail distance from school and parks. You are sending a norm that is not necessarily okay to be seeing cannabis stores as you walk through your daily walk to school and back. And billboard content, and not for kids symbol, and so on. We already have all these environmental changes and constraints to make cannabis less risky. So I'm going to now talk about making my case for policies, hopefully, which promising policies. And I'm going to borrow from other areas to make my case here. So let's talk about behavior economics for a bit. So studies consistently show that a default option is more likely to be chosen, and the default option actually exerts a powerful influence on choice. So in behavior economics, default is the recommendation for healthy choices. So make the healthy choice the default and make this healthy choice an easy choice because most people choose it. If you were to not prohibit things, and that's not what we are saying, we are not in prohibition mode here, you can still let individuals make other choices, but make them actually have to work to engage in these less desirable behaviors. So I'm going to give examples in different areas of behaviors here to make the case and then see how we can apply for cannabis. Nutrition, immunization, retirement savings, organ donation, you name it. Let's start with nutrition, and I'm going to give an example from all examples I could have from the Disney Corporation. So the Disney company, about a decade ago, they decided to change their default children menu. It's like, well, why our default is not for drinks, 100% juice, low-fat milk, and water. And for a side dish, let's put it fruit or vegetables. And they tested this and see what happened, knowing that before that was sugary drinks, pop, and soda, and French fries. So as soon as they did that, people went to the default. 2/3 of the parents and kids, maybe not the kids, but the parents certainly chose the kids menu that were the default with fruits, vegetables, and juice. And the satisfaction did not went down on Disney company food, and this was a big public health gain. Imagine this being, being adopted more widely. So again, the default being a healthy choice makes it a very easy. I was thinking about that when I had the cookie today at lunch, and honestly, I felt relieved that this policy wasn't quite implemented here, but if you were, I would have the fruit. Immunization, so talking now about adults in healthcare settings. Immunization for healthcare workers seems to be annual immunization, a pretty good idea. I mean, they're protecting themselves, flu vaccines, as they are protecting also the clients. Regardless, in only 40% of healthcare workers nationally take their annual shot. One hospital here in Washington State decided to do the opposite. Instead of saying the default is you choose if you want to take or not, the default is you take the vaccine every year. If you do not want to take, you get out of your way, and then you have to just do a little document and say, I don't want to take for religious or for philosophical reasons or for health reasons, and you're out. It's not mandatory, but it's the default procedure of this hospital. And what happened is they went from 40%, the national average, to 98% of immunization from health care workers, flu vaccine. Retirement savings, very similar. Actually, retirement savings is a very high adoption even when you don't have the opt-out version, which is like it's automatically in, you just have to say no. Regardless of the policy you have, 75% of people that have access to 401ks and retirement savings, they say yes. However, some minorities and people of lower income are way more reluctant to sign to retirement savings. When you give the opt-out, meaning you are automatically enrolled unless you say, I don't want it, for people that makes lower salaries, my thing is going here, so it goes from workers with make less, it goes from 12% to 79%. For Hispanic workers, go from 19% of enrollment to 75%. So again, making the default, the easy choice, the obvious choice, the regular choice makes a difference. Same for organ donation. You have a 60% increase in organ donation when you have an opt-out policy. You have to say no. Automatically you are saying yes unless you want to say no. So this is a little bit what you have when you have these policies based on behavior economics. And then you wonder how we would work was this approach when it comes to cannabis, and particularly cannabis as a factor on preventing the onset of psychotic disorders. So putting all this together. So cannabis use a modified risk factor in the onset of progression on psychotic disorders, and there is at least 3 action points in a market that is legal, where people can purchase cannabis. You can at least delay cannabis use initiation. The earlier you start, more likely you are to have cannabis use as a risk factor. Discourage use of high THC products, discourage frequent use. What kind of policies considering behavior economics, where you are trying to make the healthy choice the default choice? Okay, so we thought about at least 3 areas where we can make policies to address this. Make high THC products harder to get, not surprise coming from me. Make cannabis retail a low-risk decision environment, or a lower risk, and balance the narrative. What are these and what are examples of this? So make higher THC products harder to get, less attractive, less the default because it's the best bang for your buck, because it's way more THC for the same price or for a lower price. How can you make them harder to get? Yeah, of course, I was saying this morning by other presenters, set the price of cannabis proportional to their THC content. You are paying for the THC mostly if you are using for mind-altering purposes. So if you sell the price proportional, you're going to have more THC is more expensive, therefore less attractive, less of the obvious choice. The other option is increase the age of purchase, not for all products. At 21, you can go to the store, but you have a different product, a different age. As you know, it was already suggested by our policy recommendations to the legislature in Washington State. Age 25 seems to be acceptable age to try. Have somebody else tried that? No. Is that possible to try? Washington can do anything. We are always a pioneer on trying new things. So that's another idea. What about making cannabis retail stores a lower or low-risk decision environment? Placement of products is used everywhere. Placement of products, you don't have to have the most potent cannabis right in front to make them such an easy choice. You actually can have a cabinet on the back. You can, hey, put it together with the 25-year-old. You can have a 25-year-old as the limit to buy this product. You can have a cabinet on the back with a key, like you have some liquid in several stores, or cigarettes. So you can place the products in a way that the first choice, the obvious what you see, is not the products that are the risky, entail more risk than others. Cannabis entail risks, of course. Bartender training, something that is in the work. You have bartenders are usually very proud of their work and very proud of making their customers to have a good experience, in part because they keep coming back then, but also because they are proud of the plant and the product they sell. Bartender training can go a long way on facilitating a healthier, less risky experience. Educational materials that are mandatory to distribute together with your product. We already tested also the bartenders' willingness to distribute these materials. If they said this is mandatory, it's our interest to comply with the rules. Continue with the high compliance of checking ID. Reduce hours is another idea that is tried in other places, like if you impulsive buy, a lot of time happens in the wee hours, on the unusual hours, so you can reduce hours to make the idea of going to a store, the decision to using cannabis, a more thoughtful, more planned one. And last, but no way less important, is balancing the narrative. What I mean by balancing the narrative? Balancing the narrative is we went from reefer madness, from stigmatization, from if you smoke a joint, you are definitely either ill or a criminal, to the glamorization of cannabis use since legalization. It's glamorous, and I mean, no wonder it's glamorous. Just look at some pictures in the ads here. So it seems associated with a lot of activities that I would not personally recommend when you are under the influence of cannabis, like, just being in a cliff in a little rock there. But, that's what apparently is being sold. And, people on the beach, people skiing, and also, surprise, surprise, as any other mind-altering products, a strong correlation with sexuality and particularly of women, seductive pictures. So this narrative, we are not suggesting we go back to reefer madness. I hope you understand that after this whole day with us, but at least we need a balanced narrative. We need to bring the lived experience of people that had other ways of perceiving their cannabis use, and they are not even marketing, they are real. We have to have people that are not exaggerating because that's their experience, and even if people are exaggerating because their experience was exaggerated, they are just telling their truth. This can be done to public service announcements, to media campaigns, and right now we have some initiatives, but man, to find these videos that we featured today, it took like weeks for us to dig into the internet and finding things because they are not being shown as much as marketing are being shown. So we need to balance this narrative. We also need to balance the narrative by having better information in Washington packages. So not surprising, you see. So this is on the left, the Washington warnings. Yeah, I mean, yeah, look really, really hard. You're going to see in the bottom there is usually font 4 to 6 in our case. No contrast color, and you have to dump all the messages at once. There is no rotating message, so the message gets even smaller because of that. In contrast with our neighbor country that, as far as I know, their industry is going as well as ours at the minimum, where they have the warning in the front of the package, yellow with black, with way greater font and rotating messages. So these messages are each package giving a different information. So this makes it bigger and can give more detail. They actually have to occupy at least 40% of the product package. Another way to balance the narrative is also packaging in itself. So again, going back to the Canadian, isn't that enough for a consumer? They are already there buying their product. They are a consumer, they are buying it. You see that you have THC, the amount you have, what product you are buying. I'm talking the product on the left. And you have in the front of the package a warning. You are being informed, you are making your decision, but you are somewhat touching on this narrative. What is at stake here? In contrast, I don't have to say where this package is from. It says 12, so you can kind of understand it's from here. And the package is all golden with the 12, doesn't even really say what is in there, except sativa hybrid. And you have on the back in very tiny fonts the warning. It is interesting because we are analyzing some of the University of Waterloo data on noticing warnings, and not surprisingly, I'm not going to have to disclose my age, but you can guess, my age group is the one that never sees the warning. And I wonder why. I mean, it's like we can't see it. I mean, seriously. Do you think we can see it? We can't see it. So it's hard to notice. So, and so this is my little spiel for today, which I think I went really fast. I wanted to just finish this by saying, let's please keep in mind that when we talk about regulation, when we talk about ways of changing the market but not shutting it down, we are not talking about prohibition. We are talking about the spirit of Washington voters that was, let's legalize cannabis with constraints and regulations. So that's me for today. Thank you very much.
All right, I'm here to ask the tough questions. Okay, so you can still submit questions now too as well, but we're gonna go ahead and get started. All right, so some of these policy recommendations are expensive to implement. Why should the state invest in these policies when other priorities exist?
That's an excellent question. That's the softball, right?
Yeah, it's the softball.
Okay, well, we are spending probably way more money by not implementing them. It's just that we may not notice, but by not implementing, is this sound strange? Is it strange?
No.
Okay, it is just strange talking then. So by not implementing them, and we have to work hard on getting researchers to really put numbers on this, but we are expanding on school dropout, we are expanding on healthcare, we are spending on emergency rooms visits. We are also spending on productive lives that are not happening because of this project. So yeah, in the immediate budget you are balancing. It may look like these are expenses to implement, but if you look at the expenses you are preventing by implementing them, no, they make a lot of sense economically as well.
Perfect. All right. Is there any concern that if we implement policies that make lower potency cannabis the easier choice, that people will smoke more and increase risk of use?
That's an excellent question. Well, that was you have to think that smoke cannabis is still the most used form of consuming cannabis. That hasn't changed. 70% of the products are still smokable cannabis. So I think we will have a gain if these smokable products don't come with, concentrates added to them. So the pre-roll joints that now have also infused concentrates, that's what we will be targeting. Still, smoking is the most important way of consumption in our state. So we would welcome seeing this being just offered in a lower potency form.
All right, next question. Many of the policies you mentioned focus on reducing use of high THC cannabis. We learned this morning that frequency of use may also be an important factor contributing to psychosis. Can you describe policies that might reduce frequency of use?
Sure. So, yeah, we are still learning. I would say, first, just on comment that, I think it was a very interesting point that was brought. What it seems to be at stake is really how much THC you inject, you're exposed to. So, let's say if people that take concentrate titrate but use frequently, or if people that use frequently lower products, if they are really exposed to a lot of THC, that's what seems matter. The other point I want to make about this thing is frequency versus high potency. If you look in the real world, daily use comes together very frequently with higher potency use. So disentangle it's a very rhetorical question of very high interest, but in the real life, concentrates are very often used daily. Okay, so I'm not trying to avoid the question, I'm just making these 2 points. What kind of policy you could do to decrease the frequency of use? I think the most important policy you can make is what I'm calling balance or change the narrative. Shaping the environment that doesn't normalize using cannabis every day, but using cannabis in special occasions, in moments that you actually choose to use. It's like make the conscious decision, don't automatically use. It's very important. So when you have advertising banalizing cannabis we have an article that is called "Every Time is the Right Time," and because we analyze cannabis ads, and that's exactly what is happening. When you try to counterbalance this kind of message that is constantly sent through advertising for selling more, it's very interesting to have daily uses from a business perspective. You are also trying to establish policies that decrease this.
Perfect. All right, several speakers have mentioned policies about marketing. What types of policies can be used to address risks related to marketing?
Risks related, I'm not sure I understand what that is, but marketing by definition is gonna sell products through ways of promoting values, desirable lifestyles, desirable attributes. So this is normal for any product when it comes to marketing. When you have a product that is addictive, that have risks, you should think about having those, and you should regulate this kind of messages. I'm not sure what they see risks about marketing, but anyway, that would be my point in terms of the content.
I think that question goes to the point of like the potential downfalls of marketing, like fear-mongering, glamorizing use, that kind of thing.
Yes.
Yeah. All right. Next question. So last year, House Bill 2320 passed, requiring the Department of Health to create a high THC sign to be posted at all retail cannabis point of sale locations. In your opinion, what is essential information someone who is consuming or will consume high THC should know?
Excellent question, and I think who should respond are the consumers and the people with lived experience that had negative effects. Science can help, we can guide them, but no poster will be effective if you don't really test on the population that are first at risk and second that have experienced the risk to know what is important to be communicated.
All right, and then I think we have time for one more question, and this one's kind of a long one. So we have two markets selling cannabis to Washingtonians, the regulated market where you have to work with Washington state regulations, then we also have online sales that are outside of the regulated market. What plans do we have for policy changes to curb online sales that are not regulated?
Yeah, let's just clarify something. I don't do policies, I do science. I can recommend what makes sense, and I can recommend policies and what makes sense. But it's not something that I'm able to talk about how we regulate the two markets. I'm saying what makes sense to be available, what not makes sense to be available, what it should be. In terms of my talk, yeah, I obviously, as the title says, I talk about cannabis in regulated markets. I think it's a very important challenge that we have in terms of online sales. But it's not something that I'm devoting, I would say the same policies. I'm not the implementation person to see how that's going to work.
All right, thank you. And I think that's all the time we had for those questions.
Thank you.
Thank you so much.